I want everyone, please put your hands together as I welcome on stage Dr. Bhaskar Rao Bollineni, Chairman and Managing Director, KIMS Hospital. Dr. Rao's leadership has been instrumental in establishing KIMS as a benchmark for quality healthcare, clinical excellence, and healthcare accessibility across the region. In conversation with him will be Ms. Kalpana Sharma, editor Times Now.in, who will moderate this insightful discussion. Ladies and gentlemen, please put your hands together. And over to you, Kalpana.
Thank you. So we are here to really go through an inspiring journey. And before I really start asking questions, I want to ask you that, what are some decisions that you feel really helped take KIMS to the level that it is today? If you can recall some really good decisions that you feel helped.
When we start this healthcare, I have had these ideas how to shape this healthcare. There are three important things. One is the stakeholders of the healthcare. When I was a consultant, I understood that three important people are the healthcare. One is the most important person of stakeholder is in healthcare is patients. The second most important people is the human resources, that is doctors, and as well as the staff, medical and non-medical staff. The third most important person is the investors. If you can able to satisfy all these three things, three people, I think you are very successful. So what I realized, these three people are need. The patients expects a quality, affordability, accessibility. These are the three important things the patients expects. As long as you deliver that, patients will be safest. That will only come when we start with a multi-speciality hospital and a full-time consultants in the organization that can able to satisfy these things. The second important thing, human resources, that is consultants, doctors, nursing staff, and all of them. We need to give a full freedom what they want and what they require to satisfy their patients in terms of quality, in terms of affordability, and also the flexibility towards the doctors where it can able to perform things. If these two things achieves, the third important thing, investors automatically make their money. That's what we have thought of when I was a consultant for 10 years. I tried and then I implemented. That is the success of the journey.
And also today, patients, today yes, but for the longest time now, they are more, to really run a hospital, you need clinical excellency as well as operational excellency. How have you really achieved that balance at KIMS?
The most important thing, clinical excellency, when you select the consultants, the right people, where they have been educated in the right institutions, their entire mindset is definitely different from a non-institutional consultants. So initially we started with the consultants to make it excellence. That may not be enough. That will be up to the 50% of the patient quality care is concerned. The rest of the 50% comes with all the other human resources. The moment the patient enters, we nurture and we build the culture of the people, how they can able to behave, both medical and non-medical, with empathy and not a sympathetic way, and they should be in a position to explain that entire culture. If you build, you can get a clinical excellency by the medical doctors, non-clinical excellency, which is equally important for the patient and patient attenders during the journey in the hospital, how they should be able to behave. They should not feel that I am not a foreign body here, and they should also part and part of the family. That culture we built in the non-medical people, that helped us a lot.
Yeah, I'm curious to know that, with KIMS expanding so hugely and on a great level, how are you managing to provide the same level of service across hospitals?
See, the policy and principle what we have been built on, like the affordability, accessibility, and then quality care, and wherever we go with a multi-speciality note, and we will be able to select the right people for the right job. Irrespective of the geographies, initially I was also thinking that moving out of Andhra Pradesh and Telangana, the entire systems will be different. It is different. The culture of the patients, the mindset of the doctors in both Karnataka, Kerala, Maharashtra, Madhya Pradesh, everywhere is different. But we need to be able to...
Would you like to elaborate on that? That would be interesting to know.
See, basically when you see, when we started here also, there was small nursing homes, independent consultants. They never come back to leave their own practice to come to a multi-speciality hospital. That we could able to convince here. Similarly, we could able to convince the consultants in both in Bombay and everywhere. They have their own nursing homes, their own clinics. They have to shut down all those things to come. We convince them the advantage, the benefit, both the consultant will get as well as the patients feel. The only fear they had was that all the corporate hospitals means they may use like a tissue paper. When they use it, they use it, otherwise they'll throw it. The legacy what I created in 2 decades, they could be able to speak to our consultants. And similarly, the political situations are entirely different, where we could be able to know here. And similarly, the culture of the patients is also entirely different. When we set right the house perfectly, by keeping all the consultants in-house, then rest all will fall in line. That is where other geographies also we could be able to do, and we could get the same results what we achieved in Telangana and Andhra Pradesh.
As a health editor, I've come across so many patients that, there's a growing mistrust in hospitals that they'll make you go through extra tests and unnecessary scans and procedures to make money. How would you like to defend KIMS in this aspect?
See, basically, it is not a fault of organization, not a fault of doctors. One important thing, the defensive medicine has come. To overcome that, that's what I keep on, build the culture. We need to explain each and every step, whatever we are doing. The proper counseling of the patient will definitely understand what we are doing, why we are doing, so that if he understands all those things, he'll never feel that we are doing an unnecessary test or unnecessary procedures. And we also have some feedback mechanism within the organization. If somebody is also following these type of things, we will take a really different actions. So that is the most important is you need to counsel the patient properly. It is not just one-time counseling. It is every day. More than a patient, you need to be able to counsel the patient attenders, especially when you get a small complication. You need to explain the complication, what will be the outcome of this complication, why we are staying a little longer time. If that culture has been built not only with the medical, also with the administration and all the patient care executives, all the billing people, so that there should be a connection from the patient journey within the organization from top to bottom. Once you achieve that, I think all these things will be able to go off. If you don't explain anything, you keep on doing the investigations, then that you'll be able to create.
Correct. Rightly said, because transparency is very important. I'll take you back to a question that I'd asked about clinical excellency and operational excellency. So in your clinical practice and operations, how much has AI evolved things? Is the adaptation rather new and you're planning to scale up? Please tell us about that.
See, basically the AI in certain aspects will definitely help. In certain aspects, it will be a little bit of a disadvantaged position. Recently, we saw one of the WhatsApp. The corporate bill has come and feed to the AI. The bill was 11 lakhs. According to the AI, it is only 20,000 rupees. So, see what is AI does. If you feed the entire right things to the AI, it will give much faster than a human being which can do the same time, same job, much faster. If you don't feed rightly, it will give all the wrong answers. That is as far as whether it is a billing, whether it is a technology or anything. There are certain areas AI has really improved, like we have seen in a MRI AI-enabled one, where previously the cerebral stroke, which has been a period of 4 hours, we got an AI, now that has been extended to 8 to 10 years to give the thrombolysis, so that the patient quality will improve. So what all the data that we need to be able to feed rightly to the AI will be able to help us to give a much faster pace and also give a little more added augmented knowledge to us. That will be able to definitely help the patient to treat, and you will also get the maximum benefit out of it.
I'm going to ask a tricky question. 10 years down the line, do you think AI will be able to replace a doctor in terms of diagnosis and treatment?
So it is not, see, as long as the lack of AI it has its own advantages. The disadvantages, there is no legality for AI. That is the most important thing. There is no human touch. The tactile sense is not available with AI. So as long as these two things are not there, and you cannot able to answer the question what the patient is asking, that much of knowledge AI doesn't have. It has whatever we fed, it will give. But here it is a personalized touch to the patient, so that whatever is the patient is asking, if you don't able to answer properly, then it will not able. These 3 reasons, AI in healthcare may not able to replace forever. It may give, definitely, suppose if you read, a radiologist can read about 100 in a day. If you are able to fit for the AI, if you give properly, it will give much faster, maybe do 1,000, but also sometimes it will go in detailed way of analyzing the X-ray. Sometimes we miss, it may also be able to find out. That much help can do, but these two are complementary, the doctor and as well as the AI.
And I absolutely agree with you. AI can never replace doctors. And with the new age of doctors and healthcare professionals coming in, with your rich experience, what is it that you want to tell them?
The most important thing, if you talk about the good olden days, we have only one doctor is to take care of the entire body. Today for the entire body need to take, at least we need a minimum of 100 doctors. So this coordination, cooperation should be there. It is required, subspecialization. But at the same time, it should be a conversational between all the departments. If the patient has a multidisciplinary approach required, we need to be able to face all these things in time. If you don't, if you keep going around, going on the volume base that I want to do, the most important thing what a junior doctor should be able to, if you can spend as much time as a patient, that is the biggest marketing tool. I keep on telling for everyone, for our own employees, doctors, everybody, for a doctor, the God is the patient on 5 reasons. First reason, he is the one who pays the money from chairman to the bottom person. Second important is, he is the tool marketing agent for you if you do a good job. Third important thing, he will able to build our communication skills. The day when you keep asking all the questions to him, if you answer patiently, your communication skills will able to improve like anything. The fourth important thing, he is the one who communicates the entire medical community. Fifth important is, he is the connects the entire globe through his case sheet in the form of publications and presentations. So in that way, 5 times he is helpful for you. We should be much, much respectable towards the patient. The day when you follow all these 5, every doctor has a practice. There is no need to worry about it.
And when you were a young doctor to today, the new age doctors, do you see any difference?
There is difference because the wave of the training is happening. A lot of things are moving on. The clinical decisions and the clinical investigations or clinical history is a little bit lapsing. More of going on a technology based, more of going on an investigation based. But as far as doctor, that's what I mentioned, whether AI is going to replace. As long as you have a human touch with the patient, taking a proper history, examination, spend time with them, counseling with them, that is the missing link today. We need to further improve on that. It will come back, definitely, there is no way.
And before we end this conversation, I want to ask you, in the next decade, where do you see KIMS Hospital?
See, today I proudly say that we are the number 1 in the globe. There is no second opinion on that. There are many patients are coming forward from globe to India. But we have few inherent problems. See, the problems are, we are very quick when compared to any of the Western society. If you want to take an MRI, you can able to get it done in half an hour. But in the reputed countries, it will take about 3 days, 10 days. To diagnose and to see a doctor, it will take about 3 to 4 weeks. It will be able to done it in a matter of 3 to 4 hours here. But what is the missing link here is, we have a large volume in the healthcare, but we never present in the form of papers, publications, when other countries are doing it. Whenever I've been traveled in many countries, whenever they see more than 2-3 patients, they will say, in my series. Here, even if you see 100 patients every day, we will never talk about all those things. So one is, a research is we are lacking, which we need any patient, the doctor has to spend a lot of time. With some engineering background we need to have. The government also need to spend a lot of money on the research that will be able to cut down the budget of the government also. So when you put all these research, you can able to go into a lot more innovations, because most of the innovations are coming from Western country, because they spend a lot of time on those innovations equally with the patients. But we focus mainly on the patients. Once the innovation comes, you will also get into the prevention aspect. Once you get the prevention aspect, the budget will come down drastically, and patient quality care, patient's efficiency also will improve. And at the same time, if the publications comes, what we are, we will be able to refer to the globe. Because of our inherited strengths, like we can able to dispose the patient, diagnose the patient, give the treatment in a fast way, the day will come, we expect a lot of patients from the globe to come to India. But the only thing is this missing link of innovations and research, publications, that will take Indian healthcare into a different level.
Very well said, and to your vision, I wish you all the best. Thank you so much for joining us today.
Thanks for giving all this opportunity with their times now. I will
Thank you so
appreciate it.
much. I want everyone, if you can please put your hands together and give a round of applause. May I now request Ms. Kalpana to please present a token of appreciation to Dr. Bhaskar Rao. A round of applause, ladies and gentlemen, please. Thank you so much, sir, for your time and the incredibly insightful discussion.